Hi, everyone. It's Kelly Brown here with you. It's February 14th, 2021. And today we have a really interesting video where we're going to do quite a deep dive on a number of different information sources, databases, media clips, and to tell a story, to paint a bit of a picture, put a little mosaic of data points together that explore various themes, including seasonality, past seasonality of respiratory viruses, that get into the cadence of what happened during the first wave back in those critical moments of March and April. Some really interesting things that I found on some public health websites that I haven't seen many people talk about. And we're going to go through those closely. And lastly, we're going to get into some of the things that happened sadly in the LTC facilities, the long-term care facilities, in that April-May timeframe. And if you make it to the end, I think you'll find it very fruitful. I think you'll end up with a new set of questions to ask, some really good perspective on what happened. You know, as we sit here today and can look back on what happened and review all the data sources very dispassionately and rationally and unemotionally, we can start asking the right questions to hopefully inform better public policy and around this pandemic. And so I think we'll have some fun with this one today. There's a lot to go through, and some I'll go through it quicker. Some I'm going to slow down because it's quite nuanced, and if you follow along carefully, I think you'll find it worthwhile. So I'll prompt you when I'd like you to listen closely. And so I'm going to do another share screen, and we'll just go into it. So let me just pop up my screen. And we'll start with, as I said, seasonality. So this is a post that I did some time ago. This is Ontario, and this is past coronavirus seasons. And really just want to show you the seasonality that we've observed in the past of other coronaviruses, human coronaviruses that circulate every year that cause the common cold. And, you know, we really see this pattern around the Christmas period here, the holiday period, week 52. We see a sharp rise, and the fall off is different every year. I've also shown this is the past 6 years that you see here, and then I've also shown this thicker line, this darker line is SARS-CoV-2. So you can see this, it obviously, we were detecting it late in the season, okay, back in April and March and April. And it appeared to tail off like previous years. The other thing on this chart that I have pointed out before that is rather unusual, which is this line here, this flat line, which happens to be the 2019-2020 other coronavirus percent positivity through that season. So last winter, the pandemic winter, we saw very low circulation, according to the Ontario data, of other human coronaviruses. So we can see that there was a peak here around New Year's when usually things do peak, but the overall positivity didn't even reach 2%. And it's just obviously different than every other year. I don't think there's any question about that. I'm going to show this, you've seen this chart as well. I'm going to this is the same data, other coronaviruses just shown on a longer time series. And you can very plainly see the past annual seasonal peak before the virus runs out of new hosts to infect and starts going the other way, you know, is anywhere between 6 to 12% each year. So this is the last 6 years. And you can see the last year that we had full circulation of other coronaviruses was winter 18 to 19, and you can see rather peculiarly again that other coronaviruses did not have the same circulation. They were virtually nothing last winter. And then I've juxtaposed over top, you can see SARS-CoV-2, these two lines, and one is Toronto, one is Ontario, and I'm just sort of showing them both for reference. But you can see that they appear to have circulated in place of the other coronaviruses. So I put the little the little emoji guy there just to kind of draw attention to it. So the other thing, so we have a question here to ask about what happened with the other coronaviruses. Now, interestingly, I want to take you over to here, which is the Public Health Ontario website that goes into detail about annual respiratory season. And every year, the Public Health Ontario publishes something called the Ontario Respiratory Pathogen Bulletin. And in it, I'm just going to scroll down, they publish these seasonal summaries every year. And they list here on the website the last 5 seasons, the latest being 2018, 2019. And I'm just going to show you just very quickly what's in these reports. So there's lots of good stuff in here. It talks about the circulation of influenza A versus B, how many cases there were, how many hospitalizations, the ages, if there was any pediatric mortality in flu, which is common, and which we know has not been common with coronaviruses. Lots of good stuff. Some of the same stuff that they put out for COVID-19, they do every year for the respiratory pathogen seasons. So I'm not going to go into detail, but I do want to show you just the one thing where they point out not just flu, but they have the other viruses here that circulate, including other coronaviruses. And in this particular chart, coronaviruses are in gray, and you can see that they've got that 10% number. It's the same data that I've shown you, just in a different format. You know, and then there's previous years. So this is 17, 18. In this one, you know, I'm showing you, they got this lovely little table. There's the coronaviruses, okay, on this last line. And then the previous year, same thing. There's a similar table here. Where is it? Well, in any case, oh, here it is. So coronaviruses. Okay, there they are. So each year we get this report. Now, peculiarly, we don't have a report yet for 2019, 2020. We don't have a respiratory pathogen bulletin report for last winter. Now, I understand that last winter was a different winter. We had COVID-19, that was sort of the dominant pathogen. But we did have a respiratory season prior to the arrival of COVID-19, but we don't have the seasonal summary yet. Now, to be fair to Public Health Ontario, I have not emailed them to ask them, you know, where it is, and so, you know, it still may be forthcoming, but Public Health Ontario, if you're listening, you know, we'd like to know where last year's report is, where you talk about coronaviruses and the other coronaviruses, which appear to have not circulated. And actually, just take you back here and show you at the top that the data extraction for the last report occurred on October 9th, 2019. So they have the data by October 2019, but we don't have it for October 2020. They just haven't put out the report yet. So Public Health Ontario, if you're listening, we'd like to hear where that report is. I'm going to go on to the next section, but just one more thing I wanted to show you that was quite peculiar that I just wanted to point out regarding last respiratory season. So this is July 15th, 2019. And there's Christine Elliott, and it says, Ontario prepares for very difficult flu season, Health Minister says. And what this has to do with, if we just scroll down, is Australia. So it says, Australian health authorities are reporting an early flu season, unusually high activity for this time of year. Though the overall severity is reported as low, hospitalizations are 3 times what is normal for this time, and there have been more than 200 deaths so far, according to that country's Department of Health. Now that's really interesting, and I don't have the context for these numbers. I haven't run this data set. You know, I'm not an expert on this, but this is really interesting, in the very least, that this happened. And there were I remember hearing anecdotal reports about a different type of flu season last year in Australia. And then, of course, you know, this is of course somewhat suggestive that there was something else circulating in the world last year. And even prior to the official arrival of COVID-19. And I'm not making any claims here, but just asking questions. And of course, some of you may have seen some of the reports that came out of I believe it was a seroprevalence study of blood samples from a cancer trial last year in Italy in late 2019 that showed antibodies for SARS-CoV-2. And there was something similar in another jurisdiction. So all of these things, I just want to kind of put out there to, ask the question, what was really going on during last year's respiratory virus season? Okay, so that's kind of the end of section 1, I'll call it. And we're going to move on to our next theme, and something that is really, really interesting. I think you'll find quite fascinating. So let's come up to this. This is the Asus pandemic tracker from KFL&A Public Health. So this is Kingston Frontenac Public Health, in Eastern Ontario. And what they've done is they've put together a really interesting tool. This is they call their pandemic tracker, and this is it here. And really, what it is a surveillance tool for public health, for physicians, for public health planning. And emergency response as well. And what it does is, because it monitors hospital admissions in real time for influenza-like illnesses, they're able to get a signal if there's something out of the normal happening, if there's admissions happening somewhere that they wouldn't expect. There might be a clue that there might be something epidemic going on. And so I don't want to go into this particular tool, and there's a number of tools that they've put out here, but there's something here called the Ontario Influenza-like ActivityMapper, which is another set of tools that is able to show these are just basic surveillance tools. So percentage of respiratory visits to the emergency department across a particular time scale. And let me just show you another for example here. This one is really neat. So this shows you, this is just all prior years, the percentage of visits to the emergency department that have a respiratory complaint. And it's quite interesting. You see, you have this spike here at Christmas. Or the New Year's. This is the last week of the year. This happens every year. And then of course, everything has been quite low this year. Now I'm going to come back to this chart, but first, I want to go to something very interesting, and that is this at the top, this little data note, which says the 2021 influenza respiratory season will be full of unknowns given the current COVID-19 pandemic, and as such, the viral respiratory mapper will be subject to constantly changing landscape. Okay, so fair enough. That's an interesting note. Now, this says continue reading. Okay, well, how many people would think to click on this? And I think maybe not many, but let's click on it. It takes us to this message here, which is one of the most interesting and peculiar pieces of note that I have seen in the whole pandemic. And we're going to go through it. So we're going to break it down a little bit. Now, I'm going to just read, I'm going to read it and we'll unpack it. So the first sentence is just what I just read to you. And so I'll jump right into the second sentence here, okay? So the 2019-2020 influenza season was following a fairly predictable pattern. When the pandemic hit in mid-March, we were starting to see our influenza-related markers returning to baseline values, and many of our health unit geographies were in their green or yellow ranges. So they're just describing that things, at least I take it to mean that things were just sort of going as normal, and in mid-March, late in the respiratory season, things were kind of coming back to baseline levels. Okay, this is where it starts to get interesting. Okay, so this sentence here. This quickly changed when the provincial government announced schools would remain closed following the March break and subsequently declared a state of emergency on March 17th, 2020. Okay, we all remember that. This is interesting. The following 2 weeks saw most of our respiratory markers spike to levels that were higher than what we see around the Christmas holidays. Many thought this spike was an indication of rampant COVID-19 spread, but this was not the case. As a province, we were learning on the fly, and the Asus system that the mapper is based on was seeing a huge influx of people to emergency departments with respiratory-related symptoms that may otherwise have been ignored or dealt with at a family physician's office. Most of these visits were neither influenza nor COVID-19 related. We know this because our provincial influenza numbers did not spike again, and COVID-19 cases did not spike until late April. We have to assume that the health-seeking behavior that caused the mapper to show large spikes in percent positivity was a mix of anxiety-based respiratory visits to hospital, coupled with a drastic drop in our overall visit volumes, which compounded the way we calculate our metrics on the mapper. Okay, there's a lot there, but it's very interesting. So bear with me, we're going to unpack it a little bit. So just want to go up to the first thing that they said, which is, this changed quickly when the provincial government announced schools would remain closed following March break and subsequently declared a state of emergency. The following 2 weeks saw most of our respiratory markers spike to levels that were higher than what we could see around the Christmas holidays. So let's take a look. We can This now is from the Health Canada database. This is number of laboratory tests for other respiratory viruses. So this is testing surveillance data, and this is for last winter, 2019, 2020. And we can see quite clearly the typical peak around New Year's, and we're sort of staying a bit elevated. And then we had this surge. And these weeks here are late May or late March, and we had this surge in testing that seems to confirm it. Now let me show you previous years. So this is the year prior, same spike around New Year's, and just a gradual tapering off through the spring. Previous year, same thing, gradual tapering off through the spring. And even the previous year, quite a spike around New Year's, and just a straight trailing off. You see little minor blips in the late spring, but no spikes like we saw in this year. So that seems to confirm that more people were going in and laboratory tests were being ordered for every potential pathogen that people were presenting with. And then the other thing, if we go back and use the actual Asus tool, so I'm just going to go back to it. We can see here that the percentage of respiratory complaints did spike quite incredibly during that week. So we did see a lot of people going in to get tested for they were scared, it seemed. So now let's come back. We're going to unpack this this note further. Just a moment. So now, many thought that this spike was an indication of rampant COVID-19 spread, but this was not the case. As a province, we were learning on the fly, and the Asus system that the mapper was based on was seeing a huge influx of people to emergency departments with respiratory-related symptoms. This is, in my mind, key, that may otherwise have been ignored or been dealt with at the family physician's office. So suggesting that some of these presentations were out of the norm, that some of these things that people were coming in with were really sort of anxiety based, wanting to know whether they had COVID or not, because this was around the time, of course, that it was circulating. And then what they're saying is, we know that this is because our provincial influenza numbers did not spike again, and COVID-19 cases did not spike until late April. And both of these statements are true. Provincial influenza went to zero at the end of March, right around that time frame, and they're right that COVID-19 cases did not spike until late April. So they are right about that, but I'm going to break that down a bit in a moment because there's some nuance there. And so just to finish off again, we have to assume that the health-seeking behavior that caused the mapper to show large spikes in percent positivity was a mix of anxiety-based respiratory visits to hospital, coupled with a drastic drop in overall visit volumes, which compounded the way we calculate our metrics. Okay, so let's regroup and look at the actual case data. that, and I'm going to pull up a couple of different charts here. So if we look, I'm going to pull up this one here. Sorry, this one here. So we see that in March, this is when our cases really started to rise. Okay, so this is when this is all cases here. Okay, but you can see that we had very low actual testing surveillance here. And we were doing less than doing a few hundred tests per day until we got up to about 3,000 to 5,000 tests per day when we actually started to see a lot of cases. Now, I'm going to show you this broken down a second way, which is this chart. So what this shows you, the blue line is community cases, okay, sharp rise, and then a flattening of the curve, quote unquote. Okay, and then this is first wave, and to July, and then we see about a month later we see the outbreak cases go straight up. So you could see that what was happening is we had sort of a tale of two pandemics here. We had a community curve that was flat, and we had about a month later we had outbreak cases. And this is the mostly long-term care and congregate living facilities happening here. Now, given what we've gone through, given everything that we've just gone through in this video, we don't know yet. I'm asking the question, I wonder if had we had the same level of surveillance testing for SARS-CoV-2 that we have here, okay, that we eventually had, would this blue line, have shown that it was actually coming down already, okay, and that SARS-CoV-2 was circulating in the population beforehand? I don't know the answer to that. I'm just asking the question. This spike in cases here, is this a true epidemic spike, or is this a spike because we had surveillance? So just asking the question here. Because as I've just shown, in so many areas of the world, we had this, this massive spike from nothing, which was deemed to be the epidemic spike. And then of course, through as we, stayed locked down and quote unquote flattened the curve, these came down. But when you have to separate this graph of all cases into, lo and behold, community cases, okay, and then outbreak cases, all right? And as we know, as I'll show in a moment, the outbreak cases, of course, is where most of the actual fatalities were, sadly. So let's go to that. This is data from Toronto. And I'm using Toronto data here as a proxy just because we don't have we don't have this granular data at the Ontario level, but Toronto being 3 million people is a good proxy. And what this chart shows you very simply is all COVID-19 mortality in Toronto broken out into 4 different groups: outbreak and non-outbreak. So outbreak fatalities being mostly long-term care and congregate living facilities, sadly older folks that have passed. So outbreak and community mortality. But then also which cases that were fatal were ever hospitalized or not. Okay, and what you see, I'm going to start with the community, which are the yellow and orange lines. And you can see that the orange line being community cases and not hospitalized. So a fatal case that was in the community that was not hospitalized. And it might stand to reason that this is a fairly low number because there's very few people, would have gotten COVID and just died at home and not presented. So that number stands to reason would be very low. And then the yellow line is the overall community mortality in Toronto that was hospitalized that ended up being fatal. And you can see that the cases, and remember, so that rose to a max of 5 per day, sadly, but a relatively low number, and then trailed off as we quote flatten the curve. Okay, so that's the community. Now let's look at outbreak setting fatalities and how many were in hospital and how many not. So the gray line are outbreak cases, so LTC and congregate living, and as a proxy, there's going to be other outbreak cases in there, but this is mostly long-term care that did not have. So this is the line here. It kind of comes up and then declines. But what you see, what I want to get to here is the last line, which is the blue line. These are cases that were outbreak cases that were fatal, that were never taken to hospital. So really, this is a place of death proxy chart. And this shows you that the great majority, the 55% of the first wave mortality took place in outbreak settings where the patients were never taken to hospital. And that's, somewhat to be expected. A lot of people, were, if you're very old and very frail, it stands to reason that, there's going to be a decision that's made to maybe not take you to the hospital and all of those things. But I'm just merely showing that, wow, those mortality curves that we see in Ontario and Canada, here in Toronto and everywhere in the world, my guess here is that, this really is to do with, that quote unquote Gompertz curve. It really represents those fatalities that occurred in outbreak settings. And if you just break it down into how much actually occurred in hospital and from the community, it's just, it's a very low number. Every death is tragic, but these are just really, really low numbers. And so I just wanted to kind of drive home the point here by just showing you this chart. So this is in Ontario, and this is just the community-based mortality, okay? And really, we have a spike here, but compared to the long-term care facilities, you'd see a spike, much higher. So, okay, I want to just leave that for a moment. And I want to go to, so I want to stick with this long-term care theme. And I want to go back to this chart, which shows the delay between the outbreak cases and the community cases, the outbreak being the proxy for mostly long-term care. And they're about a month. And if you look at the peak, okay, the peak here is like mid-April, and this is by episode date. So this is the date that people got sick, not necessarily the date that they died. But, that is well into April. I mean, we had been locked down since around March 22nd, and really we were sort of unofficially all staying at home prior to that. But that community curve was flattened, and then things started to happen in long-term care facilities. So I'm going to take you over to a report here from the Ontario Science Table, and this is on long-term care facilities. And this is a very long report, and I actually suggest you read it if you have time. And one of the things that they tried to do was they talk about, they make correlations between the rate of community spread, and then how is that a predictor of outbreaks in long-term care facilities. And they make some correlations to show that, yes, community spread is the biggest, I don't want to misconstrue the words, but community spread is the biggest predictor of long-term care facility outbreaks. So then though, they go into a section here, risk factors for COVID-19 outbreaks and resident deaths in Ontario's LTC homes. So what they tried to do is see what the time lag was between when there was a case in the community and when there was a case, an outbreak in the facility, in a long-term care facility. So here we go. I'm just going to read this first couple of sentences here. The risk of COVID-19 outbreaks in LTC homes is strongly associated with the rate of SARS-CoV-2 infection in the communities surrounding them. And the second sentence is very interesting. However, the temporal relationship between rising rates of SARS-CoV-2 infection in the community and the risk threshold for subsequent LTC home outbreaks is not well defined. And essentially what they're saying is, we know there's a relationship, but we don't know the timing of that relationship, and there doesn't appear to be a clear signal of when community will then result in an LTC outbreak. And you can see here they do the blue line is active cases in the community, and the yellow line here is outbreaks. And they say for the entire province of Ontario, there's a lag time of about 23 days. But then if you look, there's a lag of 11 days in by region, 24 days in Toronto, 25 days in the east. And then interestingly, I want to call your attention to the north region, a lag of 43 days. So, but also what you might find peculiar is the level of community spread here was extremely low in the north. So we're talking Sudbury, Thunder Bay, Temaskaming, 4 or 5 regions up, 5 or 6 regions up in that area in the first wave here. And if you look, I mean, there were still 11 outbreaks in the north region with very low community spread. Now, granted, this number of outbreaks did not actually produce a lot of cases and fatalities, but still, this is really interesting to note that they couldn't find a relationship here, and also note the timing of the outbreak. So this is like on this time scale. This is like in May. You know, we had been locked at home for 6 weeks at this point, and they're still having problems in the long-term care facilities. And, you know, one other thing that they write about that might help shed some light on this, again, just to sort of fact find and put all this together is, I'm sorry, I'm going to just scroll to something else here. In the same report, just down a little bit further, they go into some of the, frankly, tragic things that happened in the facilities. And if you just bear with me. So, impact of the COVID-19 pandemic on the health and well-being of LTC residents. So there's a fairly graphic description of what happened here, and it's quite sad. Just basically talking about some of the very squalid conditions that happened here, and I won't read it, but I encourage you to go and read it. But one of the things that they show here, okay, is, I'm going to read this part. One common concern regarding the mental health of LTC home residents during the COVID-19 pandemic is the increase in use of psychoactive medications, which were frequently overprescribed prior to the pandemic. A previous report documented increased prescribing of antipsychotics during the pandemic to people living with dementia in the UK. A population-based study of all Ontario LTC home residents found that prescribing of psychoactive drugs started in March 2020 during the onset of the COVID-19 outbreaks and public health restrictions in LTC homes, which persisted through September 2020. Increases in prescribing were out of proportion to expected trends over time and distinct from observed prescribing changes in other drugs during the pandemic. And these charts are just simply stunning. So these are changes in prescription patterns. The vertical line here is the March lockdown. And you can see that antidepressants went up, antipsychotics went up, statins actually went down. These are not huge increases from trend if you actually look at the number scales, but they definitely, you know, diverge from trend. And so, you know, it doesn't sound like this was a very fun place to be during this part of the pandemic. And you know, a lot of these deaths are, you know, these deaths are very tragic. So what we want to do is wrap up that end of the discussion. I don't want to end on that note, but we're kind of getting there. So let me just maybe what I'll do is just kind of come back and tell recap the seasonality that we went through, okay? And we talked about how, you know, the previous years had quite you know, an observable pattern, and, you know, we got to get to the bottom of why other coronaviruses were not circulating last year. I hope it, you know, again, public health, if you're listening, you know, let's get that respiratory pathogen bulletin board out there and tell people, you know, where those viruses were last year. You know, this really interesting note that I went through, the COVID-19 message from KFLA, which talks about some of the cadence that happened. That was quite interesting. And then just finishing off with some of the tragedy that happened in the LTC facilities. Now, what I'll do is I think I might end any video that I do with this here, which is of course age stratified case fatality rates. And we really got to hammer home this message, because there's a lot of people out there that are overestimating their risk. And then I think there's a lot of people that are underestimating their risk. Kids, parents, anyone under 59, 69, the risk levels here are really low. We've got to get those schools open. We've got to get parents, we got to let parents know that, schools are safe, not because there's kids are masked or because there's cohorting or, there's dividers up and they can't talk to each other at lunch. That's not why they're safe. They're safe because case fatality rates for kids are so low. And for you parents, they're low as well. And, I really, want to finish on that because it's a good news story and we know who to protect and we got to keep doing that. So I hope you found this video interesting and, keep following along. I really appreciate everyone that retweets the data that I put out there. I read all the replies. I try to get back to all of them, but I can't. My DMs are always open. And as always, just come back here so I can say goodbye. DMs are always open. I appreciate all of the engagement. Let's keep the discussion going, and let's get some really sane public policy going here. Let's get society back. Let's get culture back. Let's get our lives back, because we've got some. There's a world out there that's waiting for us, and we gotta get back to that as soon as possible. So that's my message, and thanks very much everyone for watching. Bye now.